platform. It is about being able to intelligently take an input that says, for example, that here's an emergency, to be able to intelligently take that piece of information and route it to all the agencies that need to press in for responding. It's about a lot of people coming together to provide with their experience and expertise input. So that is what something like an emergency response calls for. These are pictures that we've taken. This is from a mobile clinic. What you see is technology allows you again the ability to connect to any kind of bandwidth. It does not have to be, you're not restricted to. It's got to be broadband. It's got to be GSM or whatever. It could be anything, and the equipment and the clinic, mobile clinic in this case, even has a little VSAT, antenna on the top. It can connect to anything that happens to be available. And outside you see, on the right side, you see people watching a screen. Now that screen, again, is a digital display, and it can be modified, it can be managed remotely. You don't need to have local content being pumped in. So technology allows you all of this. Now you could well say, this looks very high-tech. It's not here, all of that. But this was in the aftermath of the Sichuan earthquake 2 years ago, when there was nothing there. The healthcare system was completely reduced to rubble. The connectivity was reduced to rubble. And in that case, in that situation, if we could do it, we can do it here. Okay, then the last example is responding to a pandemic. Now, on the left, you see a lot of sources of information. The one that I do want to point your attention to, though, is buildings and devices. Buildings and devices can give us a lot of very valuable information pertaining to pandemic or a situation. We have sensors that are available today that can identify various kinds of air quality, for example. And each of those sensors is picking up very, very valuable information. It can be exception-based, so it's not as if you need to collect and collate tons and tons of data. It can be exception-based. But bringing all of that information together and being able to then populate something like this, which is just our visualization of how, if we were to have a response system to the H1N1, which was when that is what inspired us to put this together. But if you were able to do that, at the back end of all of this is again the ability to integrate a large number of sources of information, a large number of systems, disparate, different, could be from different countries, different languages, different protocols. So it's not as simple, the issue is not simple, it is complex. But the technologies are there, and if we are able to think from the point of view of what we want to do, I believe strongly that we should be able to achieve something like this reasonably easily. Okay, so what we've seen so far from all the examples, clearly connectedness is at the heart of it all. And what we are talking about connecting is the healthcare ecosystem, which is a very, very complex one. So it's about clinics and hospitals, obviously. It's about clinicians, physicians. It's about labs. It's public health organizations, not-for-profits. It could be health insurance payers, emergency response systems. It could be even social services, for example. So, it's a lot of different players who need to come together, each of who have valuable information within their system. And somehow we need to be able to harness the power of information that together can really bring up issues and be able to help us deal with a lot of them. So I'm going to now look at the not for India point that was brought to my attention first. So first one we always hear about is technology is a cost, and that's the way we seem to continue to view any investment in technology. I can see a lot of faces nodding. I can see a lot of heads nodding, a lot of faces smiling, because I know many of us relate to this issue. But the point is that when we've heard this both yesterday and today, technology is very much necessary for our situation, for our country. benefits, even if you were to do a hardcore cost-benefit analysis, benefits will outweigh costs in the medium to long run. Not necessarily in the short run, in some cases, yes, but definitely in the medium to long run. And I would like to urge that whenever we look at a healthcare investment, a technology investment in a healthcare, we look at it not merely from the point of view of a return on investment, but also, what is the real impact that all of that is going to have on the country or the community in the long run, and be able to pull that into the whole framework. Sometime back, we had formulated something called a benefits index, and we believe that having an index of that nature may be more meaningful to looking at, especially large-scale interventions and large-scale change, may be more meaningful to look at something like that than at just numbers, just at a cost versus revenue, cost versus benefit equation. Clearly, there are many issues, and I've listed several of them here. We have had discussions around them. But I think the fundamental thing is that we need to think in a holistic manner. So if you looked at any of the examples that I presented a while ago, take the pandemic one, for example, we do have to think about, in the long run, what do we want to do? What is it that we are trying to achieve? And once we've got that framework clearly identified, once we know what the issues are that we are tackling, it would be much easier, because everything else will then fall in place. The other question is around change, and this is true. It's not a healthcare-specific issue. It's true of everywhere that we look at technology interventions. Do I really have to change? What are you asking me to do? And we've proven, though, that technology adoption is not always hard. It's not as if you need a high level of literacy to know how to use a mobile phone. It's a simple thing. The point is, once people understand what they're going to achieve with it, how they're going to do it very easily, what is it going to mean to them in terms of benefit, people will find their way around it. And therefore, when we think about the literacy divide, and we always say that that would be an impediment to our being able to adopt technology, I believe that need not be the case. Again, so long as we focus on the benefits and the end point, what is going to happen because of that adoption, and focusing on the applications rather than on the technology, we will be able to ensure much larger scale adoption. The last point about learning from every patient encounter. We've talked a lot about the fact that we have thousands, millions of people going through our healthcare systems day in and day out, every single day. And yet, and we've talked about evidence-based pathways, and we've talked about all that. But what we should also be thinking about is, can we look at trapping the knowledge that comes from every single encounter? Today, it all goes into individual doctors' minds, and that is absolutely right, because that experience is what then helps identify the next time a similar symptom comes up. But can we find a way to trap and codify some of that knowledge? Is there some way of being able to document it? Is there some way of being able to transmit that knowledge on a much wider scale than has been the case till now? And the reason I bring that up is because we do have a significant shortage of medical professionals, and that's our reality. So what we really need to focus on now is being able to learn from the patient encounters. And then this is always the issue. We have too many challenges. Yes, we have many, many, many challenges. But again, we cannot afford to wait until we've resolved them, because we never will. So the thing is, can we leapfrog to world class? And I believe we can. But the way we can do that is by looking at the issues holistically. Obviously, the technology, bringing it all together, being able to visualize what it is going to do, all that is certainly important. Policy is important. Being able to strengthen our institutions is important. Being able to look at thinking long-term, but picking up projects that are more clearly, you have a boundary around it, you know what it's going to deliver, you know what issue it's going to solve. But at the same time, remembering that there are linkages with everything else. Prevention is better than cure, so whatever we talk about, any curative system that we think about necessarily should have also a preventive side to it. And so long as we continue to think about every single piece as also having a preventive side, we will be able to move much faster. And then obviously, I did touch on this, focus on the health benefits as a whole. Even some of it is going to be quantitative, some of it is going to be qualitative, so be it. So in summary, technology is very much the answer, especially when we talk about scale and being able to access. We need to break down the barriers that we today have in our minds, both on the government side and the private side. We are seeing private-public partnerships coming up in a big way. A project that I'm associated with in Karnataka, where we've got the government is an equal party and an equal partner in a consortium. And what we're trying to do is look at community-centric development empowered by technology. At the same time, empowerment, that to me that's a big word, but and trust. These lie at the heart of anything that we do. So we talked about that complex healthcare ecosystem. At the heart of all of that, making it work, is trust. It is empowerment. So that we do need to focus on those kinds of issues. Agree, they are extremely soft, very difficult to get to, but we do need to focus on those. We do need to have bridging mechanisms so that the digital divide that exists today gets bridged. So, while we think about websites and lots of information on the internet, let's look at also how we're going to provide access to people who may just have a mobile phone or maybe have access to a computer through a common service center. So we do need to think again about how information is going to be shared across the entire population. And then whenever we think about health, we think about a whole bunch of allied issues, nutrition, sanitation, and so on. So all those, of course, go hand in hand. But my final submission is that technology introduction could well be a complex process. And in the case of something like healthcare, it is. But if we manage it well, we can avoid it being a very messy thing. That's really the surmise, is that we need to be able to think through, plan well, and execute. With that, thank you very much for listening. I'm around and would love to interact, have your comments, and any questions. Thank you very much.
And all departments, but if patients are also interconnected,
yes,
their patient education, awareness about their illness, and the support they gain from each other by being member of the same society, like in abroad we see a lot of societies such as Alzheimer's Society, or people suffering from epilepsy being together and empathizing with each other.
Yep.
So that connectivity will also enhance the patient care.
100%. And if you look back to this one, it does have a lot of content that is also about patients coming together. So the epatients.net, if you're not, I'm sorry because there's a lot of content there, but there's a website called epatients.net, which is where patients can have discussions. So they are able to talk about their experience, they're able to give advice to others. We're also seeing, for example, Facebook, which today is putting up, groups that allow people with a certain condition to discuss, to share information, and so on. Even on Twitter, you can follow a certain a site that or a group that is discussing a particular condition. So yes, I'm completely with you there. It is about empowerment. It is about bringing the community together, allowing people to share information. Along with that, of course, there is always the other side, which is making sure that the information that goes in is correct and relevant, and you don't have it all becoming clouded with a whole lot of misinformation. But having, if you're able to resolve that issue and have responsible communities, absolutely, that does lie at the heart of prevention. Thank you.